this is from the general population. And in 2008, the government came out with physical activity guidelines for Americans. Any of you familiar with these? Okay, there's actually a website, okay? And if you just Google physical activity guidelines, you will find the website. But these are guidelines that the CDC put out in 2008 after conversations with large groups of people. And this is what they came up with. They said aerobic activity, so activity that is mainly for your cardiovascular system to maintain health and wellness. They recommend 2 hours and 30 minutes of moderate intensity aerobic activity every week. What does this mean? 150 minutes a week. You can spread it out 5 days a week. 30 minutes will get you 150 minutes. They even suggest that you can break it up into smaller chunks of time during the day. 10 minutes at a time is fine. And what do we mean by moderate intensity? I can take the technical definition, tell you what it means in terms of heart rate, VO2 max, this, that, whatever, but that's not what I'm going to do. What it means in simple terms are activities where you can still carry on a conversation. So if you try and take a brisk walk with a family member, or walk your dog, or you're raking or mowing, shoveling the snow if you live in the Northeast, cycling, line dancing, anything, doesn't matter what activity. It is activity that will get your heart rate up a little, but still allow you to have a conversation with someone else. That is the definition of moderate intensity exercise. And I say to people that to me, and especially growing up in India, I used to take public transportation. It wasn't unusual that I would walk 10 to 15 minutes to get a train station and then ride, and 30 minutes later walk again for 30 minutes. So physical activity was always woven into my life. And I realized that especially some cities, they're dependent on the car for everything. And so that component of physical activity that was part of my life is not so as much anymore. So how might I compensate for that? When I go to a grocery store or a shopping mall, I do not circle to find the closest spot. I try and find the farthest spot and walk over. What does that mean? That means that I have to allow 10 or 15 minutes. If I'm rushing, of course, I'll find the closest spot. But if I'm not in a rush mood, I can say, you know what? I'll just do some walking, extra walking, find the farthest parking spot. So one of the things I would suggest to you is, if you enjoy formal exercise, if you can do it, if you have the ability, the means, availability of a site, please do it. But if that is not a possibility, because of work, because of family needs, children, not enough time in the day, see how you might be able to weave physical activity and exercise into your daily routine. And that's what I try and do. And again, it'll depend on your abilities. If you can take the stairs, go up a flight instead of waiting for the elevator for 3 minutes. So again, this is where the individualization comes in. Depending on your abilities, what you can do or cannot do, and how can we weave things into your daily routine. Strengthening activities. They recommend 2 or more days a week of muscle strengthening, especially the major muscle groups: legs, hips, abdomen, back, shoulders, arms. Now we know that one of the first groups of muscles to be affected are the shoulder girdle. And so a lot of the upper body exercise does become difficult. But we can still continue to work on the lower body. The abdomen is another area that's very, very weak early on in this disorder. I don't have to tell you. I'm sure all of you have noticed the difficulty you have getting out of bed. You have to turn to the side and then bring yourself up and do a sit-up. Again, depending on the gradation of weakness, there are things you can do or cannot do. And one of the recommendations I make to people is if we can get people starting to exercise sooner rather than later in the course of the disease, when you still have a certain amount of strength. And what do I mean by that? When you go to a neurologist or to a physical therapist, they'll look at your strength, and we measure strength on a 0 to 5 scale, all right? And grade 3, which is sort of the midpoint, is the ability to lift a body part against gravity, okay? I can lift my arm up against gravity is what we call it. 4 is the ability to lift against gravity and take some resistance or lift a weight. And 5 is considered normal strength. Less than 3 is where you cannot move a body part against gravity. So I would not be able to do this. But if I were lying in bed, okay, I'd be able to move my arm sideways. Or with buoyancy in water, I might be able to move. So ideally, if you're going to start exercising, you need to at least have what we call a 4 strength or 4 minus strength, where you can take at least a certain amount of resistance. Because if you're already having difficulty doing things against gravity, you're most probably using your muscles to the max, just moving against gravity, okay? And it's going to be very, very hard to try and strengthen muscles that are already that weak. So really, it's the muscles that are in the better stages that we want to try and work with. And to that extent, the earlier that we start, the better off we are. And there are different ways you can do this. You can just use body weight. You can use free weights. You can use elastic bands, hydrotherapy, whatever. And again, that's the personal conversation you have with your therapist or whoever is overseeing your rehab protocol, if you will. Let me say one more thing, and that's about, we've talked about aerobic, we've talked about strengthening, and this came out of an international workshop that happened in 2010, where a group of people, neurologists, physical therapists, patients, others, came together as part of an international workshop that was held by the European Neuromuscular Center. And these are the recommendations that came out, that, we would recommend aerobic exercises, we would recommend strengthening exercises, but as essential are the flexibility and range of motion exercises. In fact, to me, they are one of the most important things, because I'm not sure how much of that contributes to the pain and discomfort and fatigue and other things that the patients complain about. And so what are flexibility and range of motion exercises? Again, as we said just now, once you cannot move your body part against gravity, it becomes hard to move. And so you have to find a gravity minimized position to be able to do those exercises. And a simple way, especially for the upper body, is in lying down. If you're at a point where even that is harder, then we have to go to what we call active assistive, where someone tries to help you, or you have, there are different devices that you can use. So if you're pulling down with this arm, the other arm goes up, and there are devices that you can use, overhead pulleys and stuff, to do range of motion. But I worry about that a little, because you want to be careful how you do these things. And then when even that is not possible, maybe you're at a point where things need to be done passively, meaning that someone else has to do them for you. Or that's where you use something like water to help you. Because water can be assistive. You can use the medium of water for assistance as well as resistance, depending on where you are in the water, how immersed you are. And this is why hydrotherapy and pool is something we recommend often to our patients. The thing I run into when I make recommendations about hydrotherapy and pools are, one, they may be hard to get to, may involve a cost. Sometimes young women especially don't like with their scapular winging to be in bathing suits, and that's their personal preference. And just the hassle of dressing and undressing. So again, this is where we need to tailor the program to the person and their preferences and what is available to them or not available to them and what they enjoy doing. Bottom line is, if it's an activity that you enjoy doing, you will stay with it. And that's what I want, rather than saying, no, you will do this so many times a day, so many times a week, etc. I myself know I don't do well with those kinds of instructions. And as a mother, I know how many times I was told, you know, how many times my child has to do this or that, or practice piano, or, you know, take care of their teeth. And as a working parent, I know it's not easy always to follow all the guidelines that people lay down for us. So rather than lay down guidelines, I'd rather make recommendations and work as a team with whoever I'm working with. And then, of course, recreational activities. You know, if you have an interest in a certain thing and that's what you really enjoy doing, then, you know, work with your therapist and how you might still be able to do some of it or some aspects of it. And so we have a whole, if you will, a basket of things that we can draw on to try and maintain our best function, wellness, health, etc. This is a long haul. It's not a sprint. People say to me, should I be going to a therapist 2 or 3 times a week? Definitely. If you've had shoulder surgery or, you know, you've had something else, definitely you need to be followed by someone. But in any of the muscular dystrophies, I do not see a patient needing to go to anyone 2 to 3 times a week for 30 or 35 years. I see more of a coaching situation where we work together, we evaluate you, we monitor you, and we make recommendations based on your abilities. Now, here I have to segue and say, you know what? We are a team, and I want you to learn to monitor your body. You are the best judge of what you can do or cannot do on any given day. We've laid out the general rules. You know, 150 minutes of aerobic exercises, 2 or 3 times of strengthening, flexibility preferably on a daily basis so that you feel good. I mean, think about it. You know, if we were made to sit in a chair, say, or, you know, not move a body part for a week, how would we feel? We need to feel that motion. So flexibility, strengthening, aerobics are all important. But I also know that, you know, if you have a teenage son and you've been busy taking them around, or a daughter that you've taken to the mall and, you know, spent all day on something, you need to read your body and decide what else can I do today, or it's perfectly fine for me to give myself a day off, and do not feel guilty about it. Learn to read your body, try and be at your maximum as best as you can. This is a lifelong journey, and we need to walk it together, okay? So what is the evidence for the current recommendations? We know that aerobic training is safe and can improve fitness effectively in patients with FSH dystrophy. There are small studies from this group. They usually involve, you know, less than 20 to 30 patients, and they usually have not gone beyond 12 weeks. But we have to take what they tell us. The biggest concern people have had over the years about exercise recommendations for patients with muscular dystrophy is the concern about harm. We definitely do not want to do any harm. That's our first principle. And more we are finding that as long as it's moderate exercise, we are not doing harm. Okay? Now, I already gave you a definition of moderate for aerobic, that you can talk, you might feel your heart rate going up, but you're not so out of breath that you cannot carry on a conversation. How about with strengthening? What is moderate? What is minimal? What is maximum? How do we define those? There I have to get a little technical. In general, what we call one max is a weight that if you lift it one time, you will not be able to lift it again. Okay? And that's not what we want you to exercise with. We want you to start low and sort of figure out what is a weight or resistance or whatever medium you're using for strengthening that you can still do maybe 10 times. Okay? And that's called 10 resistance maximum, 10 RM. And start with something like that. And I would say even cut back from it. Okay? So my recommendation is start low and go slow. Gradually build it up. And then persist with it.